in this video, I'm going to be talking about the different types of surgery you might be offered if you've recently been diagnosed with breast cancer. I'd love to invite you to subscribe to our channel. We're always putting out new and updated content, often in response to your requests. I'd also love to invite you to go to Yerbba.com to get your personalized Yerbba report. That will tell you about your options, not just surgery, but other treatment options you might hear about. It's updated with your medical records after you give us permission and is aligned with the most recent medical research to offer you the things you might hear about when you go see the doctor and the pros and cons of different treatment types. So go to Yerbba.com and get your personalized Yerbba report. So as you go through breast cancer and you start to face treatment decisions, surgery is one of the things you're going to hear about or you may have questions about. I'm going to be talking about the different kinds of surgery you might hear about throughout your breast cancer experience. The first thing I'm going to talk about is the surgery on the breast itself. And there are two main types of surgery that are offered. One is breast conserving surgery, where the breast mound and the contour of the breast are preserved, and the tumor itself is removed with a rim of normal tissue around it. This is also called lumpectomy or partial mastectomy, a whole host of other names. But basically, the bottom line is you're keeping the breast and removing the tumor. The other is mastectomy, in which all the breast tissue is removed. These are separate from removal of the lymph nodes, which I'll get to in just a moment. So the decision between breast conserving surgery and mastectomy is based on a few things. The most important thing is, can the tumor be removed from the breast and leave a cosmetically acceptable result? What I mean by that is, if the tumor is removed with a rim of normal tissue around it, how will the breast look afterwards? Even if you're not somebody who's self-conscious about your breast, having a disfigured breast is really upsetting to people, and surgeons don't want to leave you with such a surgical outcome. So if the breast tumor is small enough that taking out the tumor will leave a breast that looks as close to normal as possible, retaining the breast conserving surgery is offered to somebody. There are a couple of exceptions. One is if the tumor is close to the tail of the breast, the part of the breast near the lymph node, it can be hard to get clear margins because there's just not a lot of breast tissue in the tail of the breast. The other is if you have an inherited susceptibility to breast cancer, you are at risk of other cancers in that same breast, you may be offered a mastectomy instead. A third situation is if you've already had radiation therapy to the breast, keeping the breast and then pairing that with radiation therapy, which I'll talk about in just a moment, is generally not advised. That's not the case for everybody. There are people who received breast radiation many decades ago where radiating the area where the tumor was is a reasonable option. As I've hinted at, if you keep the breast, usually radiation therapy to the breast is recommended. What we want to do with radiation is kill any cells that left the primary tumor and tracked through the breast tissue that we can't see. Even with good margins, we do recommend radiation therapy. Most people start with a mastectomy or lumpectomy and an assessment of the lymph nodes, which I'll get to in just a moment. I also want to encourage you to stay through the end of this video because I'll talk about reconstruction after mastectomy and oncoplastic surgery after a lumpectomy. So if you're interested in that, stay tuned for the whole video. So I've talked about the surgery on the breast to remove the primary tumor. That's either breast conserving surgery or a mastectomy. Next, I'm going to be talking about lymph nodes. Lymph nodes are the glands that drain the body and catch bacteria and cancer cells. We have thousands of lymph nodes throughout our body. The lymph nodes receive lymph fluid from tissues, again, all over the body. You know, when you have a sore throat, sometimes the glands in your neck get swollen. That's because those lymph nodes are draining the head and neck region. A breast cancer, breast cells drain to the armpit and other parts, but let's focus on the armpit lymph nodes first. And knowing whether the lymph nodes have caught up those cancer cells or not helps us determine what stage the cancer is, and also can help in defining the best treatment options for you or someone you love for whom you're watching this video. So we need to sample the lymph nodes or take a look at them to see if cancer has spread. And if there is cancer in the lymph nodes, many people will be offered what's called a lymph node dissection, where the lymph nodes are removed, and we use different anatomic boundaries under your arm, how the muscles align, to remove the fat pad in that area. So we don't see the lymph nodes and take those out. Rather, that fat pad is removed, and we never know how many lymph nodes are in that fat pad. And in people over 70, we have data that sentinel lymph node assessment can be skipped or omitted if the tumor is small, stage 1, good margins, and the tumor is estrogen receptor positive, and the patient's willing to take endocrine therapy. Omitting surgery and radiation therapy can be options. You can see that this is very personalized. This is not because of ageism, this is because we have data. The next thing I want to talk about is what we do to help your breast, help you be happy with the appearance of your breast. So the first is breast reconstruction after mastectomy. And this is done in an attempt to recreate the breast mound. So our breasts have a shape to them that's referred to as a mound. And when the mastectomy is done, it removes that breast tissue. And many people don't want to have a flat chest. They'd like to have a breast mound. So reconstruction can be done to help recreate the mound. Sometimes the procedure is done on the other breast to make the breast match in appearance and size. We have another video all about breast reconstruction. I also want to make a point about oncoplastic surgery. This is in somebody who's had a breast conserving operation, a lumpectomy, and that surgery led to a larger gap in the breast tissue than is acceptable to the patient. Oncoplastic surgery is a specialized type of surgery that helps recreate the breast mound without a major reconstructive operation. Breast surgeons can be trained in oncoplastic surgery. This doesn't have to be done by a plastic surgeon, whereas breast reconstruction does. I've covered a lot in this video. I hope it's been helpful. Drop a comment or a question below. How did you make the decision? Were you given a choice, or was the tumor such that a mastectomy was the best thing for you? We love hearing from you, and we get back to you just as soon as we can, usually 1 to 2 weeks. Thank you for watching, and we'll see you next time.